All right. Hi, everybody. Good morning. Dr. Rafid here, Vet Triage. It is September 28th, 9:23 a.m. Pacific time. We are going through the same journal here over the past few live streams, JAVMA, December 2017. This one is, it's a long title here. It goes, Assessing Quality of Life in Dogs using surveys, questionnaires with the dog owners. So it's called Psychometric Properties of the Canine Symptom Assessment Scale, a multidimensional owner-reported questionnaire instrument for assessment of physical symptoms in dogs with solid tumors. So this was the University of Pennsylvania. They had 238 client-owned dogs with solid tumors, which is not a bad number in the veterinary field. They devised a questionnaire that was originally describing 14 symptoms for dogs, but they narrowed down to 12, and we'll go into that in a bit here. The symptoms were defined as subjective physical disturbances dogs experience during the course of daily living as assessed through proxy reports of pet owners. So the idea there that if you're an adult human who can speak on your own behalf, then you are reporting your symptoms to the doctor. If, however, you're speaking on behalf of a child or a dog or something like that, then you are the proxy for that information, sharing the symptoms with the doctor. For each symptom, owners reported frequency and severity of the symptom and the extent of distress caused by the symptom for the dog and the owner. So the dog has symptoms, and then the owner, the pet owner, is going to be interpreting those symptoms on behalf of the dog. And that's the idea here, is to give him a more well-rounded view of any given symptom and how it correlates to that dog specifically in the eyes of that pet owner. The results showed that symptom prevalence was high, with pain and lack of energy reported in most dogs. Severity versus frequency was most highly correlated with both dog and owner distress. So pet owners, when they view these symptoms, they prioritize the severity of those symptoms more so than the frequency. So it's not necessarily how many times you're vomiting, for example, it's how bad each episode is. So that's very interesting to note. They took the 12 symptoms that they whittled this thing down to and grouped them into three big factors: malaise, anxiety, and gastrointestinal upset. And they took scores based on that, which demonstrated predictable relationships with quality of life and pain scores as measured by the Canine Brief Pain Inventory. So they're saying that when scoring these symptoms, it actually does predict quality of life and level of pain that the dog has at home if afflicted with a solid tumor. There was a significant association between increasing symptom burden and decreasing quality of life. And that's what you'd expect, right? As symptoms are more severe, the quality of life is viewed to be worse. So in their introduction, they mention here that subjective physical disturbances experienced by human patients are termed symptoms. And in the veterinary field, we avoid the term symptoms. We use clinical signs because we have pet owners speaking on behalf of the animals, and clinical signs are what the doctor is interpreting from not only the history, but the physical exam findings. However, this paper wants to argue that if in humans, they're going to call symptoms of the children, for example, who can't speak on their own, by their parents, their caretakers being the proxy for them, then we should change the terminology in the veterinary field. And that actually helps in terms of telehealth as well, because in telehealth, you're relying even more on what the pet owner is telling you and what they're showing you with the pet on video on Vet Triage, because you can't manually manipulate that pet. You can't perform a physical examination because it's over video as a doctor. And so this paper actually is in strong support of telehealth and giving pet owners more credibility when they're describing symptoms to the doctor and then trying to assess what symptoms are severe and not in the eyes of the pet owner. So that's a huge win there. Okay. A growing body of evidence indicates that subjective experiences not only exist in dogs, but can be measured with proxy reports from pet owners. As such, subjective physical disturbances dogs may have experienced during the course of their daily life should be referred to as symptoms. So it's a pretty strong stance to have, and I'm surprised that JAVMA published it, but that's where we're going with this. The traditional method of symptom assessment in human clinical trials involves a continuum of information transfer from patient or proxy to clinician, to the medical record, to a study database, to a manuscript, and then each step is reinterpreted. We don't have that level of structure in the veterinary space. Obviously, the patient, as I was talking to us, it's the proxy, then the doctor puts it in the medical record, and that's pretty much where it ends. We don't have a database necessarily. We don't have a manuscript, and there's definitely no reinterpretation unless you are, called out by a medical board or something like that. Then it's being reinterpreted, but by then it's too late anyway because you're being reported to the medical board. So what ends up happening in the veterinary space is the information in the medical record reflects the perspective of the medical person rather than that of the patient, and that's what they see in people when the symptoms, severity, and frequency are not taken into account from a doctor's discussion with the patient. Something happens in the veterinary field. 19% of recently published trials actively collected data pertaining to symptoms of the patient studied. The methodology used for these symptoms rely on clinician adjudication. So what happens is if you're relying on the clinician to interpret the symptoms, then what ends up happening is the less severe symptoms end up getting kind of ignored or put on the side, and you also have an underreporting of symptoms. Okay. Patient reports are considered an adjunct to clinician reports, enabling earlier, more accurate, and more comprehensive detection of symptoms. So they're arguing here that they want the patient reports to actually weigh a bit heavier than what they currently are. Pet owners are considered valid proxies for reporting observable events, such as physical symptoms. And that's a pro-telehealth statement there. There are validated owner-reported instruments, including those for pain and quality of life in animals. So it's already been done before, and it's shown to be validated. These instruments are best suited for clinical rather than research applications because of the inclusion of few symptoms, lack of psychometric testing, and reliance on open-ended responses that cannot be easily quantified. Existing questionnaires focus on frequency and treatment of symptoms, but do not attempt to quantify how severe a symptom is or how much distress or lack thereof that an animal or pet owner experiences as a result of it. So this questionnaire was based on a human criteria called Memorial Symptom Assessment Scale. It's been validated, multidimensional instrument that assesses frequency and severity of and distress associated with physical and psychological symptoms in human beings. So they modified this study based on that. Okay, perfect. We're not going to go into the statistics of this because it's a bit more complex than I understand it. And the questionnaire itself, they even admit here it's kind of complex. So we're not going to go over it. But they factored in the complexity of the questionnaire and made it where pet owners were hearing the questionnaire first verbally and then filling it out. And this was a 5 single-center clinical trial of cancer treatments located at University of Pennsylvania. Okay, so let's go then to their results and discussion. We already mentioned the results earlier, but this is going into more detail regarding it. The 14 observable symptoms that were selected include pain, lack of energy, panting, coughing, pacing, difficulty sleeping, aggression, sleepiness, vomiting, diarrhea, lack of appetite, constipation, yelping or crying out, and moaning, groaning, or whining. And the symptoms of pain, lack of energy, and panting were the most prevalent, occurring in over 50% of dogs. And that's true. We get that in vet triage as well. Pain, lack of energy, and panting is very, very common. Among dogs that experienced a symptom, frequency and severity were moderately to highly correlated for all symptoms except for diarrhea. In general, symptom severity rather than frequency was more highly correlated with dog and owner distress. So we mentioned that before. The severity of the symptom had more weight than the frequency. Dog and owner distress were highly correlated for all symptoms. So it all matched up, right? If the symptoms was seen as severe, the dog distress was severe, so was owner distress, and the reverse was also true. Owners reported feeling greater distress about the symptoms than they perceived their dog to feel. Owner distress scores were higher for all symptoms except for aggression and constipation. And so those are the two factors that were eliminated from the study, was aggression and constipation. And they do hypothesize later on as to why that is. We'll talk about it. So then they took those 12 factors, lumped them into 3 big categories. They had malaise, anxiety, and gastrointestinal upset. Malaise included the pain, lack of energy, sleepiness, moaning, groaning, whining, yelping, crying. Anxiety included panting, pacing, difficulty sleeping, and gastrointestinal, anorexia, vomiting, diarrhea, and cough. The reason why they put cough and gastrointestinal is because esophageal reflux in dogs, like heartburn, for example, in people, can manifest itself as a cough. In fact, I just had a telehealth session this morning with a dog that was coughing, had diagnosed with pancreatitis prior, and so the differential there, top one, was esophagitis or esophageal reflux. And then of those 3 big categories, malaise, anxiety, and gastrointestinal, malaise was the biggest one. The anxiety score and digestive score may not be reliable as independent subscales. So when you look at each subscale independently, malaise is number 1. Pain and lack of energy were each reported in approximately 75% of the 238 dogs in the study. These were also the most frequently reported physical symptoms among human cancer patients, as determined by the Memorial Symptom Assessment Scale. So that's pretty wild. The humans with cancer show similar frequencies of pain and lack of energy as dogs with cancer do. Cancer-related fatigue is highly prevalent in humans. During and after cancer treatment, cancer can cause fatigue as a result of direct effects on metabolism and muscle strength, but fatigue can also occur because of sleep disturbance, nutritional issues, emotional distress, pain. Pain, lack of appetite, and crying or yelping out were the most distressing events, whereas panting, sleeping, and cough were less distressing. And that makes sense. If you're a pet owner, you're always worried about your dog or cat or whatever not eating, but especially if they seem painful or they're yelping or crying, that creates a lot more distress. The high degree of correlation between dog and owner distress suggested anthropomorphizing, but response patterns nevertheless indicated that owners were able to distinguish between dogs' experience and their own psychological state. So that's pretty interesting. So one of the reasons why we developed clinical science is because veterinarians always thought, well, the dog is being interpreted by the pet owner, and they're going to humanize the condition and anthropomorphize the clinical signs. And so we always thought that was kind of like it invalidated it. But it's interesting here that pet owners actually are able to say, well, it's distressing to me. Doesn't seem like it's really bothering my dog. Symptoms such as lack of energy and sleepiness were reported to be minimally distressing to dogs, but worrisome to pet owners. Now, the reason why aggression and constipation were removed, we believe, is number 1, with constipation, dog owners don't really report it unless it's like tenesmus, which is straining to defecate. So unless they view that level of constipation, they don't really recognize it. And aggression is more of a behavioral trait that is correlated with temperament. So some dogs will never behave aggressively regardless of health status. Others will behave aggressively despite being in perfect health. So they removed those 2 factors. All right, finishing up here. They identified dose-response relationships between symptoms and quality of life. So as the symptoms increased, quality of life decreased, and vice versa, which we've already said. Perfect. So they do mention here, to finish this, although this was designed as a research outcome measure, this may have clinical applications to it. Veterinarians seek to minimize symptoms, support normal function, and maintain good quality of life. So it may be that because pet owners are the best judge of those factors, that studies, questionnaires like this might become implemented in actual clinical settings. Owners who seek treatment for their dog's cancer and participate in clinical trials could differ in terms of education, finances, philosophies, other important things, compared with those who do not elect to pursue any kind of cancer treatment or research. And so that can affect who answers these questionnaires and who doesn't. Further examine reliability, validity, and responsiveness with repeated administrations, improving the interpretation of scores. So they're just saying ways that they can improve the study here. But yeah, this is pretty interesting. So this is again from JAVMA, December 2017, showing progression in how we are interpreting the impact of symptoms on dogs' quality of life if they have solid tumors. Oh, and by the way, for those who don't know, for solid tumors, let's go. They had a chart here about it. So they broke down solid tumor types, malignant bone tumor, malignant oral tumor, and splenic hemangiosarcoma. And there's no surprise there, especially with splenic hemangiosarcoma and bone tumors. Those are very common tumors, but those are examples of solid tumors. So, tumors that would be not considered solid tumors are things like lymphoma, for example, or histiocytic sarcoma. Those are not considered solid tumors. And for lack of a better explanation, solid literally means there's like an actual mass there, a solid mass, whereas the ones I mentioned are more like immune system type of cancers that are a bit more diffuse in the body. You can't really like palpate them per se. So, all right, everybody, thanks so much. We'll be back tomorrow for another live stream. Thanks. Bye. 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 Bye.